Welcome back to NurseEdScholar. Get ready to learn about respiratory acidosis. Understanding this critical condition can enhance your nursing career and help you save lives. Let's discuss the key symptoms, causes, and essential nursing actions that can make a difference. To begin, respiratory acidosis is characterized by a decrease in the total concentration of buffer base in the blood, coinciding with a relative increase in hydrogen ion concentration. As a result, an elevated number of hydrogen ions in circulation exceeds the buffer system's absorptive capacity. The etiology of respiratory acidosis is multifaceted and often includes primary pulmonary system dysfunction or normal respiratory pattern alterations. Essentially, any condition that leads to airway obstruction, resulting in hypoventilation, or that depresses respiratory function can contribute to respiratory acidosis. So, some examples of these conditions are asthma, atelectasis, brain tumors, bronchiectasis, bronchitis, the use of central nervous system depressants, emphysema, chronic obstructive pulmonary disease, also known as COPD, hypoventilation, pneumonia, pulmonary edema, and pulmonary embolism. When managing any acid-base imbalance, it's really important to closely monitor the patient's level of consciousness, put protective measures in place to keep them safe, assess their electrolyte levels, and of course, follow up on arterial blood gas results regularly. Clinical manifestations of respiratory acidosis that nurses should look for include a low pH and elevated arterial carbon dioxide levels, or PaCO2. Neurological symptoms might show up as lethargy, confusion, dizziness, headache, and in more severe cases, even coma. So, regarding cardiovascular manifestations, it's important to be vigilant for decreased blood pressure, dysrhythmias, and warm, flushed skin. Neuromuscular signs may include muscle weakness and the potential for seizures. In the respiratory system, nurses may notice an increased respiratory rate and depth as the body tries to expel excess carbon dioxide. However, if a respiratory dysfunction exists that prevents adequate compensation, hypoventilation and consequent hypoxia are likely to occur. So, nursing interventions for patients experiencing respiratory acidosis should focus on monitoring signs of respiratory distress, administering oxygen therapy as prescribed, positioning the patient in a semi-Fowler's position, and encouraging and assisting the patient to turn, cough, and perform deep breathing exercises. It's really essential to alleviate restlessness by enhancing ventilation rather than resorting to tranquilizers, sedatives, or opioids, since these can actually further depress respiratory function. Additionally, be prepared to carry out prescribed respiratory treatments, suction the airway if indicated, and in cases of severe acidosis with carbon dioxide levels exceeding 50 millimeters of mercury and signs of acute respiratory distress, prepare for potential endotracheal intubation and mechanical ventilation. In conclusion, we've covered the fundamental aspects of respiratory acidosis. I encourage you to watch the acid-base series, take detailed notes, and prepare thoroughly for your exams. If you're a future nurse, hit subscribe and like. I post weekly to help you succeed. Until next time, take care from NurseEdScholar.